Have you ever heard someone say they have PCOS and wondered what that actually means? Let's understand this properly. Yeah? Polycystic ovarian syndrome, often called PCOS, is one of the most common hormonal conditions affecting women of reproductive age. It affects how the ovaries work. The ovaries normally release one egg each month, okay, in a process that we call ovulation. Ovulation is part of what creates a regular menstrual cycle. But in PCOS, ovulation does not happen regularly. The ovaries receive hormonal signals that are out of balance. Because of this imbalance, eggs begin to mature, but many of them do not fully develop. Ovulation may not occur, all right? So those immature follicles can accumulate in the ovary. On ultrasound, they may appear as multiple small cyst-like structures. That is where the name polycystic comes from. But here's something important. PCOS is not simply a problem of cysts. It is primarily a hormonal and metabolic condition. Now let's talk about what someone might actually notice, okay? Ovulation itself cannot be felt. So the first sign is usually changes in menstrual cycles. Cycles may become irregular, very far apart, like more than 35 days, absent for many months, okay? Some women may also notice signs of higher androgen levels. Androgens are hormones that are normally higher in males, but females may also produce small amounts. When androgen levels are higher, a person may develop acne, excess facial or body hair, right? Hair thinning on the scalp. Another important aspect of PCOS involves how the body handles insulin. Insulin is the hormone that helps move sugar from the blood into your cells. Many people with PCOS develop insulin resistance. That means the body must produce more insulin to keep blood sugar normal. Higher insulin levels can then stimulate the ovaries to produce more androgens, which worsens the symptoms. This is why PCOS is associated with increased risk of weight gain, pre-diabetes, type 2 diabetes. Now here is something many people worry about. Does PCOS mean someone cannot get pregnant? No! Pregnancy is still possible. However, irregular ovulation can make timing conception more difficult, right? That is why medical evaluation is helpful if someone is trying to conceive. Early diagnosis allows doctors to address number one, hormonal imbalance, metabolic risk, fertility concerns, and treatment is available. Management may include lifestyle measures such as weight management and exercising, medications that improve insulin sensitivity, hormonal treatments to regulate your menstrual cycles. The goal is not only symptom control, it is also long-term health protection, because untreated PCOS can increase risk for type 2 diabetes, high cholesterol, cardiovascular disease. So here is the key message or take-home message. PCOS is common, manageable, and treatable. Irregular periods are often the first signal, and recognizing that signal early allows people to get the care that they need.